everyone. Welcome to our webinar today. For those of you who don't know me, my name is Sarah Samuel. I use she, her pronouns. I'm an informationist at the Taubman Health Sciences Library, and I'm here with my colleague, Diane. Diane, would you like to introduce yourself?
Sure. I'm Diane Wilson from the Medical School Office of Regulatory Affairs and have helped with different things relating to clinicaltrials.gov and FDA things in the past. And I'm very happy to be here helping Sarah, who is really the expert on NIH.
I'm happy to be here with you, Diane. I'm so glad that you're all joining us as well. So what we're going to do today is we're going to provide an overview of the National Institutes of Health's new data management and sharing policy. So we'll do an overview of the policy first. We'll take a look at an example plan, and we're going to go over some frequently asked questions that have come up so far in both NIH webinars and in things that we've done here at U of M. And then we'll have some time for questions at the end. So this policy was introduced with the goals of advancing rigorous and reproducible research and promoting greater public trust in research. And another goal is that the policy will promote better data stewardship, where data management and sharing are viewed as integral parts of the research process and are adequately planned for from the beginning of a project. This policy was developed with public input and was actually released back in October of 2020, but the policy itself goes into effect this coming January 25th, 2023. So the actual policy states that all NIH-supported research that generates scientific data is required to have a data management and sharing plan, which is to be submitted with the grant application. While it's not required to actually share the data, it does expect that applicants will attempt to maximize appropriate data sharing. Researchers are then expected to comply with their plan as well, and it will be monitored at regular reporting intervals. For those that are sharing their data, the policy encourages the use of established data repositories. The policy also notes that scientific data should be made accessible as soon as possible and no later than the time of an associated publication or the end of the performance period of the award that generated the data, whichever comes first. So in summary, really the two primary points of the policy are that the researchers should first make a plan for their data, then actually follow that plan. And I want to emphasize that the policy applies only to NIH-funded research that produces scientific data. The policy specifically notes that it does not apply to research and other activities that do not generate scientific data, including training, infrastructure development, and non-research activities. And there is a link at the bottom of the slide, which will take you to a page with more details about which types of research activities the policy applies to. And we will be sharing a link to the slides after the webinar. So then the next logical question is, what should a plan contain? So the NIH released a supplementary document with information about what elements are expected to be in a data management and sharing plan. And those are first data type, which is a brief description of the scientific data. Then related tools, software, and/or code, which is where researchers would indicate specific names of the tools and software needed to understand and reuse the data. Then standards. So this is where any standards that will be applied to the scientific data or the associated metadata should be noted. Data preservation, access, and associated timelines. So this is where researchers would note when the data will be made available and for how long, and also where information about a repository should be provided or how the sharing will occur. Then access, distribution, or reuse considerations. So this is where there would be a description of any applicable factors that might affect subsequent access, distribution, or reuse of the scientific data, such as any limitations, if there's a data use agreement, or anything like that. And finally, oversight of data management and sharing. So this is for indicating how compliance with the plan will be monitored and managed, frequency of oversight, and who's going to be doing this. And data management and sharing plans are recommended to be 2 pages or less in length. And it's also important to note that individual institutes and centers may have additional data sharing requirements. So it's really good to just check the funding announcement or connect with a program officer to be sure there isn't anything else that needs to be required. And the NIH has...
Sarah?
Yes.
Excuse me, we have a question in the chat.
Oh, yes, I see it. Thank you. Yes.
Okay.
Does using retrospective data also constitute new data and hence require a data sharing plan? So really what the policy is any new applications to NIH beginning in January 25th, 2023, they need to include a data management and sharing plan. It doesn't matter if the data is going to be, for the project, if the data is going to be newly generated or if you're somehow using existing data, there needs to be a plan included with that. And what that plan contains will be different if you're going to be using data that already exists. You know, that's where you can describe, I'm going to be using this data that already exists. It already has some limitations. So maybe there's only some part of the project data that you'll be able to share, for example. So I don't know if that fully answers the question. Diane, do you have anything to add to that?
Yeah, I would just say, if it's a new gathering of retrospective data, the plan, your expectations regarding a plan would be the same as if it were prospective. If you're talking about using someone else's data set to do something else, that's where it gets a little more borderline and complicated. And, you could certainly talk to Sarah or me and we can help in connecting with NIH on that specifics. But if it's really just reusing a data set that someone else created, it might not apply. But retrospective gathering of data would still be a new data set that's being created.
Yep. So in general, I mean, and I'll get to this a little bit later, is really just that the NIH just wants to see researchers really thinking about their data prior to beginning their project and trying to make a plan for how they're going to handle it, whether it doesn't actually matter what kind of data it is. So just going back to the slides here, and we'll have time for more questions later as well. So please keep putting them into the chat if you think of anything. The NIH has actually had a data sharing policy in place since 2003. So what's new or different compared to the previous policies? So these are just a few notable differences. So first, the new policy applies to all projects that produce scientific data, not just those research proposals seeking 500,000 or more in direct costs, which is what it was before. The new policy provides a lot more guidance regarding the contents of a plan, as we just saw when we looked at the elements of a data management and sharing plan. The old policy from 2003 simply states that researchers are, quote, expected to include a plan for data sharing or statewide data sharing is not possible, end quote. So that really left a lot open to interpretation. Additionally, the new policy actually recommends depositing the data into an established repository if choosing to share the data, whereas the previous policy didn't mention anything about the method of sharing. And another notable difference is that the new policy explicitly states that there are allowable costs which should be written into the budget. And this wasn't the case with the previous policy where nothing was mentioned regarding the budget. Also, compliance will likely be more rigorously monitored. The previous policy didn't have a section outlining compliance or monitoring. And the new policy explicitly states, includes a section where they cover compliance and enforcement. And they do note that non-compliance may affect future funding decisions. And again, this doesn't cover all the differences, but these are some of the main ones. And in summary, these changes really show how NIH is increasingly viewing data as a valuable research product that should be shared as widely as possible. And they really want it to be well planned for from the beginning of a project. And I see we had another question come in. So are there some recommended repositories and or data formats? And are there requirements or guidance for detail in data dictionaries? And are there example budgets to look at? So we'll get into some of this information later on during the frequently asked questions, but yes, NIH does have recommended repositories. The data formats it's going to be dependent on the type of data that you're working with, but repositories will often have information about recommended formats based on how open they are and how easy they are to be able to share or reuse. And then regarding the requirements or guidance for detailed data dictionaries, the biggest thing is just, try to think about when you're writing a data dictionary to think about how is someone else going to understand the data that you've collected, right? So can you provide enough detail to help them fully understand what do each of these variables mean? How are they collected? Things like that. And then we'll talk a little bit more in just a minute about the budget during the frequently asked question section as well. And then I just saw another question came in. This is for NIH proposals, not active research data sharing plans that need to be revised, right? Yes. So this new policy is explicitly for new NIH proposals. That being said, I have heard that some of the institutes and centers, some of the program managers are asking researchers to try to think about putting their current research data plans into this new format. So As far as I know, in general, it's applying to new stuff coming out January 25th and later. However, if a program manager is asking for something in particular in the new format, that's just something to be aware of, that some of the institutes and centers may be asking for the new format already. But in general, it's just for new things. So practically, what does the new policy mean for researchers? So one thing that will change for many is that they need to start considering how they will be sharing their data before even starting a project. And knowing that the data will be shared may have an impact on things like the informed consent if working with human subjects, may have an impact on aspects of the study design. So for example, how the data is collected or if standards or common data elements are used. Additionally, if it's likely that a particular data repository will be used in order to share the data, it's really useful to connect with that repository during the planning stage, because the repository might actually be able to help provide some useful details for a DMS plan, and they may have suggestions for managing data during the project, which will help make the sharing process at the end go more smoothly. And also, it's just something to consider is that, it's one thing to come up with a plan for the data, but it's also important that researchers think about, is this plan actually able to be implemented? And, what can we do to make sure that we have what we need in order to do that? And one of the ways you can do that is by adding data management and sharing costs to the budget. So it's really important to do this, not only to make sure that the data management and sharing activities are funded, but it will also let NIH know how much these activities actually cost. And released with the NIH policy is another supplemental document with information about allowable costs, which is linked to on this slide. And so that's something that we'll talk about a little bit more in the frequently asked questions as well related to the budget. And finally, the last thing is that researchers may need to ramp up their documentation strategies and procedures. So when sharing data, it's really important to be able to share the context of that data so that others will be able to better understand and use it in the future. Having thorough documentation will enable researchers to provide accurate and detailed metadata to accompany their data when it's shared. Okay, so we're going to transition, and one resource that is provided by the NIH is a format page for a DMS plan. It's currently in draft form as a PDF, but an editable version is supposed to be released sometime this fall, to be determined. So I just put in some screenshots of this format page rather than opening up the PDF itself. So I'm not going to read all the text, but I'm just going to highlight a few of the important things. So this format page lays out the elements of a data management and sharing plan in order, which we went over in the earlier slide. But it also includes some prompts to help researchers fill in the information for each section. So one important note is that the instruction text that's in italics for each of the points should be deleted from the final DMS plan. And since the recommended length of these plans is 2 pages, deleting that extra text will help researchers really stick to that length. Another note is that researchers do not have to use this document, this particular format page, as long as they address all the elements of a data management and sharing plan in their proposal. And yes, as I said before, we will be sharing out a link to the slides after the presentation. So the first element where it is focused on data type, and underneath data type, you can see the format page sort of broke it out into 3 different sections. So first, the type and amount of scientific data expected to be generated in the project. The second letter B says scientific data that will be preserved and shared and the rationale for doing so. And then finally, a description of the metadata, other relevant data, and associated documentation. The second element, related tools, software, and/or code. And then there's also a section about standards. And again, you will be able to explore this in more detail through the links from the slides. And then element 4, data preservation, access, and associated timelines. And again, they broke down into sort of 3 different sections. So the first one is the repository where the scientific data and metadata will be archived. And they do have information about selecting a data repository from NIH linked to from the format page. The second is how scientific data will be findable and identifiable. So for example, if it will receive some sort of persistent identifier. And then the third section is when and how long the scientific data will be made available. And then the fifth element is about access, distribution, or reuse considerations. And again, there's some three different options here. So sections here. So factors affecting subsequent access, distribution, or reuse of scientific data, whether access to scientific data will be controlled, and then protections for privacy rights and confidentiality of human research participants. And then finally, the last section is just oversight of data management and sharing. And in general, this is most likely to be the PI in most cases of who's going to sort of have oversight of the plan. And again, we will be going over some of the frequently asked questions about the DMS policy in just a little bit, but does anyone have any questions about the format page before we move on? Yeah, we will be sharing the slides, and yes, usually the persistent identifier that people will get is a DOI. That's pretty common these days with repositories. Yeah, and then I see a couple questions came in. So one, can you talk about qualitative data sharing, in particular, data that cannot be sufficiently redacted to protect privacy and confidentiality? I'm thinking about several data sets we have and likely to generate in the future, where we could redact the identifying elements like name, location, but the overall story a person tells would make it easy to re-identify the participant by those who know them or have heard of them. So this is getting back to that, the issue where, you know, that idea of maximizing appropriate data sharing. And this is something that I think in general, researchers and the NIH are going to be figuring out for a while, is trying to figure out what is that tension between like confidentiality and protection and data sharing, right? So one thing to think about with qualitative data is, are there aspects of the study collection or study design that could be shared to help someone essentially like replicate the study, potentially using, you know, other participants? So like, you know, what are the like interview questions that were used? How was it coded? Things like that. So that's something to consider when you're writing a plan. You know, I think it's important that people acknowledge if there's going to be any sort of issue with sharing the data, that's something that can be written about within the data sharing plan, saying, you know, we won't be able to share this aspect of the data. However, what we can share is X, Y, and Z, for example. So that's something to consider. And that's also something that would be good to have a conversation with a program manager about as well. They're going to be, I think, a really big resource for folks as they're coming up with these data management and sharing plans.
I want to just jump back for a moment, Sarah, to
Yeah.
Chelsea Tadgen had a question much earlier
Oh, I'm
about
sorry.
the NIH proposals, not active research data sharing plans. That's exactly right. If you've already got a data sharing plan that exists from a grant that's ongoing, this has nothing to do with that. This is only about grants going in that are going in effectively in January of 2023. So there might be some that are submitted slightly before that because that's the due date, but it's not about anything that's already worked out between you and NIH.
Thanks, Diane.
Yep. And then there's a comment, it seems very short if you have many fields of data. And again, this is, I'm assuming, related to the 2 pages. So 2 pages is recommended for your plan. And that doesn't have anything to do with, so within your plan, you're not going to be describing the specific, like a lot of the specifics about your data set. You can describe it in sort of more general terms. But that being said, if you need more space to properly describe your plan for managing your data, it can be longer than 2 pages if it needs to be. The 2 pages is what's recommended, but clearly, you know, if you need to more space to address the requirements, then please do so. Do you have one that is completed so we can see which parts were deleted? So again, going back to Diane, can you just go back a slide? So under, or even to, want to go, yeah, there. So there you can see there's the bolded text, and then there's like the text that's in italics. And so the italics text, that's what, when you're filling out the format page, you can just delete those extra descriptions. So they're just there to help you figure out what should actually be put in there. And then I see some generalist repositories. Yes, so that's a list of some of the repositories. that you can deposit data into. Yes, thank you, Peter, for sharing that information. Will ORSP and or med school check the data sharing plan as part of their usual application review before submission to NIH? I can't answer this with a complete yes or no. My guess is that the most that they would do is, one, check that there is a data management and sharing plan included with the application. And second, if they have the time to do so, they may just check to see that the specific elements are listed there that are supposed to be in the data management and sharing plan. But I don't think they don't have the expertise in order to actually review for like looking at the contents of what's actually written there. They'll just check to make sure, is there a plan and have the elements been addressed at most? Diane, I don't know if you have anything to add to that.
No, I was going to, I was looking to see if Heather was on this call, if she wanted to jump in, but we may have follow-up. Jane, if you wanted to jump in with anything further on that, feel free. But there will be more information upcoming in the next few weeks about sort of methodologies within the university.
So thank you, Diane. So I can say that the Medical School Grant Services and Analysis Office won't be able to completely understand what the plans are. And so Sarah was right. I don't know exactly what we're going to look at yet. I'm sure we will do something to see if the information is there or maybe certain parts. But as Diane said, the more information we have, we'll be able to give you a better idea of what we're going to look at.
Awesome. Thank you so much for sharing that, Jane. Just going through the chat some more. So note that OSF or Zenodo will auto-generate a DOI for me. Yes, most repositories have that. That's a feature, like when you deposit a data set, when it's published, you will receive a DOI for your data. And that includes like Deep Blue here at University of Michigan as well. I see a question. If you use samples collected through NIH funded research for sponsored research that would generate new data, is a data sharing plan needed for such a research proposal as well?
Yes.
So
sorry,
go ahead, Diane.
It would be, if you mean samples as in actually like tissue samples or something like that, those are not considered data. And there was a question earlier too about very personal information from interviews and things like that, where just redacting certain things might not really make them de-identifiable. So there are some things, and we'll have an FAQ on this about like what isn't scientific data. Let's kind of park a few of these. Feel free to keep adding them in, but I'm thinking maybe to make sure that we cover sort of core information, let's just kind of park these for the moment. And then if you still don't feel like your questions are answered after the FAQ section, then we'll be happy to try to address them more live, and or of course, you're welcome to correspond with us.
Yes,
but
thank you, Diane.
Tissue are not data.
Yep. All right, thanks, Diane. Yeah, so let's move on and we can come back to some questions in a little bit. So now we're going to take a look at an example plan. So this particular example that Diane's going to get that open for us. Thank you, Diane. And this is an interesting example because it actually has at the top, it's an example of what a plan would look like under the current policy from 2003. And then you can see how that was transformed into the new format as required by the new policy, which is going into effect in January. And so I'm not going to read through all of this in detail, but I do encourage you guys to revisit this and review in more detail if you'd like. But I would like to highlight a few key points for each section. So if you want to head back up to the top, Diane, that would be great. So so again, at the top, you'll see an example plan that would have satisfied the 2003 data sharing policy. So it includes a description of the data, that the de-identified data will be shared upon request with the data sharing agreement, and that a part of the data will be published as supplementary information or shared in a repository. But the bulk of the document really is in the format of this new data management and sharing plan. So for each section, you'll see a short annotation describing what should be included, and that's what's in, I believe it's the orange boxes. Yeah, the orange box, yellowish orange color. So this first section, data type, includes a description of the data, including approximately how many participants there will be, what type of data will be collected, and what format the data will be in. Next is the tools, software, and/or code. So this section provides details about what types of software were used for collection and analysis, including version numbers. And then after that is a section about standards. So information here includes any standards used when collecting the data, if any common data elements were used, and then they note if a data dictionary will be provided. Section 4 is all about the data preservation, access, and timelines. So this is where a repository could be named. You would note that a DOI will be created for the data set or how it will be findable. And then the timeline information should also be included here. So when the data will be available and for how long. And then finally, we have the access, distribution, or reuse considerations. So this is where any limitations on data sharing should be discussed or how security concerns will be addressed. And then the last section, oversight, is where information is shared about who will be responsible for the plan and its implementation. And in most cases, this will be the PI themselves. So now I'll go ahead and turn it over to Diane to go over some of the frequently asked questions that have come from both NIH sessions and some of the interactions that we've had here at U of M.
Thank you, Sarah. It helps if I unmute. Yes, I'll cover a few frequently asked questions. And then again, there may be a little time left at the end for additional follow-up questions from your chat. The NIH has done several webinars and they are accessible on their webpage and has been collecting frequently asked questions to address some of the details of the policy. We're going to cover some of theirs now, but we've also added some questions that have been asked of us here at U of M as well. So first off, am I expected to share all data generated during my research? Well, a reminder that this is, the goal is to maximize appropriate sharing of scientific data. And scientific data itself is defined as data commonly accepted in the scientific community as of sufficient quality to validate and replicate the research findings, regardless of whether the data are used to support scholarly publications. So you can't limit it just post hoc to, I did this publication, now I have to share that amount of data. But scientific data does not include lab notebooks, preliminary analyses, completed case report forms, drafts of scientific papers, plans for future research, peer reviews, communications with colleagues, or physical objects such as lab specimens. The data is the data that can be put in an electronic format. Further, if there is a reason why sharing scientific data is not appropriate, then that should be just documented in the data sharing plan. But these questions need to be considered in advance of the grants proposal and in advance of and informing any informed consent documents. So I want to catch one question that had been asked just a little bit ago about with a retrospective study, what if there was no provision in the informed consent for sharing that information? Then generally speaking, you would not, if an informed consent doesn't allow sharing, then you wouldn't be sharing it, but you would need to say in your plan for data sharing, because this is using old data gathered under informed consents that didn't allow for any data sharing, I feel constrained ethically to not be sharing the part that relies on that. There might be other data that you're gathering from other sources that you could still share. And similarly, prospectively, you want to think about those informed consent documents that you're going to be using to make sure that they support the maximal sharing that you're proposing in your plan. Also, just to mention that non-research grants, and Sarah touched on this earlier, especially training and fellowship grants, would not fall under the data sharing policy in the first place, at least at this point in time. And looking at their new forms, they're kind of leaving placeholders that maybe in a decade that will change, but for now, training and fellowship grants are not involved. Okay, next question. What are justifiable reasons for limiting the sharing of data? Essence is you simply need to explain what limiting factors relate to your project. Now, there are some projects that by definition would not share the data. So under a small business innovation research or small business technology transfer programs, awardees may withhold applicable data for up to 20 years after the award date. That's part of the funding agreement, and it's consistent, excuse me, with that program's goals. But there are other times when proprietary data can also arise. For example, if you had co-funding from the private sector and a pharmaceutical or biotech company had a concern about your sharing data. So NIH is aware that there are times when data sharing may be limited by those restrictions imposed by licensing limitations or other proprietary concerns, but they expect you to identify those in advance and describe what data you can or cannot share based on that. There could be confidentiality questions as well, as touched on earlier. And it is worth remembering that some repositories have such sufficiently strict data access policies with the equivalent of data use agreements in them that data could be appropriately put in them. Certificates of confidentiality remain kind of attached to the data under which they were acquired, but nonetheless, when in doubt, ask more questions, talk to your program officers, or come to the sources of expertise within the institution, and we'll help you sort those things out on a case-by-case basis. But reasons that are not sufficient to limit data sharing are listed here, like, oh, it's just a little pilot study. That doesn't give you an out. Or we don't think people will use this data very well. That's not a good excuse. Or I can't find a good repository. NIH believes that appropriate repositories do exist for essentially anything. So when should scientific data be shared? In essence, as soon as possible. And they're taking this far more seriously than in the past. Sarah talked earlier about how the data must be shared no later than the first of either a related publication date or the end of the performance period. This is a big change. Formally, you might not share your data until months after a publication. But I also want to flag there are some kinds of data that need to go into repositories on an ongoing basis. For example, the standard approach for the National Institute of Mental Health National Data Archive, NDA, their data submission expectations are semi-annual, that is, every 6 months. When you think about it, that makes sense, especially in the context of those large, those large registries, where the whole purpose is to maximize efficient data sharing, allow lots of different research to be done from those investments that NIH made in gathering data about certain populations. But there are other contexts, like in clinical trials, generally speaking, and especially where researchers are masked as to randomization, where the data could not be shared until all of it was collected and analyzed, which presumably means that you're not doing some kind of sneaky little publication before you're done with your trial. I've seen things like that happen in the past, and they were maybe perfectly appropriate then, but there may be some new approaches to thinking about timelines going forward. Who will review the DMS plans? The peer reviewers are not going to see the image of the plan. When they look at their portfolio of what they're reviewing, that's not part of it, but they will see the budgetary elements that happen to show up in relation to it. The program officers are undergoing training right now as we speak at NIH, and their goal, especially in the beginning here, is to bring plans in line with the goals. So we don't need to panic. Oh, my plan isn't going to be a perfect plan. This is fairly new territory for a lot of areas, though some areas like genetics may have been doing it for much longer. But the fact that the program officers may, kind of work with us a bit at the beginning doesn't mean that we can just sit back and say, oh, well, they'll tell me what I need to do. We still need to have respectable plans with those 6 elements that we really can follow. And then if there is a concern with them, we need agonize that it's impossible to tweak in any way. Researchers need to familiarize themselves with the ethical or legal constraints on the data that they're going to acquire, think about the nature of their data and the metadata that they'll be gathering, and what their good options for repositories are. And then they need to draft the data sharing plan accordingly, but also keep that plan in mind as they're doing their other document creation. So informed consents need to echo appropriately what was going to be shared from the data plan. And then, of course, in their actual data management practices, as they're doing their research, they need to think about that plan, follow the plan all through the period of implementation. And we can expect that over the next year or a couple of years, there will be additional clarification and sort of more models that are available. So as with other NIH policies, we see sometimes a policy establishing new goals, principles, and requirements, but further fleshing out comes out over time. So how will compliance be monitored? So that's sort of a two-part question, in that within your plan, you need to say how you're going to monitor it. And that, as Sarah alluded to, will generally for now just be the PI is going to be assured that this is going to be followed. But we expect that the RPPRs will be updated to include some questions about compliance with the data management and sharing plan. So for example, in the instance of at semi-annual submission to the NDA, there might be some field that allows for a connection or an identifier of that information having been put in. But if it's a 2-year trial, all of whose data cannot be, none of whose data can be really accessed until the trial is completed, then the RPPRs would presumably say the equivalent of a not applicable at this point, because it's premature to share the data under the plan that was proposed. What should the budget look like? So there are still a number of things we don't know in detail, but we do know that all costs must occur during the performance period. Researchers and grant staff should consider whether specific costs will be incurred for setup, management, cleanup, and data deposition. NIH provides one example on their website. For example, if a DMS plan proposes preserving and sharing scientific data for 10 years in an established repository with a deposition fee, the cost for the entire period must be paid before the end of the period of performance. Just yesterday, Halloween, the annotated Form Sets H was promulgated by the NIH. And in the direct costs section, it says, if a data management and sharing plan is included, you must include a data management and sharing costs line item covering DMS costs, including personnel costs. For example, the personnel who will be curating the data for the project. In the justification section, it says, if a DMS plan is included, you must include a section titled Data Management and Sharing Justification that provides a brief summary of DMS activities and the justification for their costs. In the short term, consult with your school and college for appropriate costs for setup, management, and cleanup. We know that ITS provides storage paid for by the provost that will be enough for most investigators' data storage. So there may not be a lot of additional costs for some disciplines relating to storage, but others may have costs that can only be charged to the grant under uniform guidance if there is a fixed cost for long-term storage. You cannot budget for future monthly costs and prepay them during the project. So that fixed cost for deposition is good, but future monthly costs would not generally be acceptable. Campus IT units are aware of these constraints and are reviewing whether there is some cost structure that can be appropriately established to facilitate this further. And always you want to check with your chosen repository and then your school or college for guidance as you go forward, and we will get more information out as it is available. What are allowable costs? Well, I've bulleted them here. And they are touched on in that Forms H that is now available. Curating developing the supporting documentation, formatting the data appropriately, de-identifying it. So there may be personnel costs that maybe in a softer data plan world, people just kind of rolled that in and didn't think about really how much time each of these steps will take. But think about whether you need a data manager now, whether you might be wanting to use some additional services through Mishar or otherwise for your data management. And then if appropriate, add those as budget items. You can see from this list that data management can no longer be an afterthought or the forgotten stepchild of the grant. Data managers and their tasks are integral parts of the research and really need to be treated as such. And that's a good thing. And, you know, I was just at COGR, Council of Government Relations, last week, and there were NIH people as well as other university people from around the country. And, you know, one of the things that was discussed was, you know, we all don't even know fully how much this is all going to cost. And so it's only by including these items that NIH will appropriately calibrate and recalibrate as we go forward. Okay, so what if the researcher is collecting sensitive information or is nervous about sharing? Well, the key here is really to think carefully about what the data you're gathering is, what makes it sensitive, whether there are hard and fast rules about it, or whether there are appropriate ways to share it. So in one hypothetical, for example, suppose you're working intensely or exclusively with a specific population, for example, a Native American group, and there is a specific extra document that NIH has posted about that that really honors the deference that we have to tribal authorities. If the tribal authority had a limitation on data sharing, then you would identify that limitation and you would constrain your data sharing to meet and honor those restrictions and obligations. But in many other circumstances, it's expected that you would be able to find a repository whose policies are appropriately structured, that they are suitable for your research. There are some repositories where you're getting full access to the data and others where you might be using it in a very sequestered enclave and that you can't actually remove parts of it. And then if it's human subjects research, you want to be sure that you build in your informed consent documents transparency with what your data sharing plan is so that participants understand what they are agreeing to. A researcher's nervousness about sharing from a concern about things like scooping that data for another publication is just not something that is really condoned in the world that we are moving into. So will researchers be able to share their data on Deep Blue? Well, that's kind of it depends. There are always good and appropriate places to share your research data, but on the NIH website, there is a list of repositories, and it's almost kind of a finder tool for repositories. And that's a really good first place to start looking, because if there is a domain-specific repository, that's probably going to already have considered many of those sensitivity questions that you have on your mind. But if none of those work for you, there are 6 generalist repositories, part of NIH's GRADE, Generalist Repository Ecosystem Initiative. Many of those, I'll just name those 6. Some of those are in the chat that Peter shared, but Dryad, Dataverse, Figshare, Mendeley Data, Open Science Framework, and Vivly are some of them. But there are other repositories like the Institute, the ICPSR repository and Deep Blue, which meet NIH's desired characteristics of a data repository. ICPSR was designed initially for social science research, so that question that involved a lot of interview data, they might be a good place to at least talk to, and they are very careful and secluded about different ways that they share data. But it's important to realize that meeting the desired characteristics of an NIH repository doesn't necessarily mean that it's the right repository for you. I mean, there's like a floor, it's not a match or a ceiling of what the requirements are. So there are vast differences between the access constraints on some repositories versus others, and those can be hugely important for meeting any privacy or security concerns that you have. So how can you advise researchers on their DMS plans? Well, first, there's some really helpful links, we hope, on this slide. And again, the slides will be shared with you. There is a link on writing a data management and sharing plan on the NIH page. And there are those samples that Sarah alluded to. You can point them to the DMS page on the research data management guide from the library here at U of M. So there are two ways you can get to this NIH material. You can do it directly on NIH's page, but you can also look at the RDSI webpage, and I'm going to spend just a few minutes touching on that. And then your school and college may also have additional resources. The med school is working on some other sample plans and some template language from HITS that may help with some of the DMP subcategories and some budget guidance. So we are continuing to work behind the scenes as rapidly as we can on these materials for you. So bottom line here is we want to recognize that data management and sharing itself is hard work, and writing a plan is hard work, and it's newer hard work than many of our researchers have done before. Most researchers do not explicitly learn this during grad school. Often the techniques and methods are learned on the job. Of course, the actual notions of data sharing have changed dramatically in the last 20 years. People learn from advisors and colleagues, and what we hope is not happening is that they are cobbled together at the very last minute to meet funder or publisher requirements. Writing a well-constructed data management and sharing plan requires decision-making and thinking through the whole arc of the research to the end of the research project, even before you've begun it. Today, we talked about the NIH policy, excuse me, but there are other data sharing policies that exist from other funders and publishers. A lot of the work around data management and sharing involves changing the research culture and workflows. So here at the U of M, the Research Data Stewardship Initiative was established earlier this year with the goal of helping researchers prepare for and meet these changing requirements. The main goal of the RDSI is to support UM researchers managing their data and to prepare to share it, improve the transparency, rigor, and impact of our academic research. This includes partnering with units across U of M to launch a new online portal that aggregates these resources and guidances to help you find them easily, assess and develop UM policies relating to research data, establish a working group to coordinate training and educational materials, of which this is one of many little offshoots, identify unmet data stewardship needs by talking directly with faculty and research teams. This initiative is quite broad when it comes to helping researchers with data management and sharing, and a lot of the effort is focused around coordinating, clarifying, and communicating what the university already offers with regard to services and research sources. So we encourage you to check out that RDSI website, and I will just make a little plug. In the lower right-hand side of that research data stewardship page, there's a nice yellow button or yellow and blue section for the connection to the NIH policy sections. And then on that page, there are 5 kind of sub boxes, one of which points to some great material Sarah has put together, including a little 4-minute video to orient your faculty to it and kind of get their minds in the right frame for it. And then also out to those NIH resources as well. So that pretty much concludes the essence of our content. Here's a list of resources. These, of course, are live links when the slides come out in just a few days. The overview page gives an overview of the policy. NIH is maintaining their own FAQ page that they update from time to time. I think their last update was July, but I'm sure there'll be more sometime later this fall. And then there is that preview and hopefully soon the interactive usable draft of the web page. Here are the links to the RDSI web site, and then the health sciences guide that focuses on the NIH policy. Also, we want to remind you that there is an electronic research notebook platform and lab archives, which you can access by going to the last link on this slide. So for bench research, that could be a particularly useful tool to be identifying and thinking about your metadata and your data organization. And now we will connect up to the slides, to the chat, and many questions that have come in. So I'm going to let Sarah take it for a bit till I can reorient. And will I stop sharing, Sarah, or?
I think go ahead and keep sharing if you're okay with that. And I would say I did just stick a link to the slides into the chat. So that is available in there. And throughout when Diane was talking, I did stick some additional links in there to some of the things that she was talking about as well. And I'm just skimming back up. So I think, one of the questions that came in earlier was, if a data dictionary is promised, is there any enforcement of this? Would it be assumed to be part of the repository? So again, this is going back to that question about enforcement and compliance. And right now, some of that is really still up in the air as far as, how much NIH is going to be digging into the details of these plans and seeing, have you actually done what you said you would do? And I think some of it right now is just they're sort of counting on faculty and for the researchers to make updates to those plans as necessary. They are able to be changed. And that's something that the NIH has sort of, when they've done their webinars, they've emphasized that this is something that can involve a discussion with your program officer when you're checking in on those progress reports. They really want researchers to make sure that those plans are staying up to date and they're accurate with what's going on with the project at the time. So if they need to be updated, if something's changed with the project, definitely update that. And then the compliance and enforcement, like we said, right now, it looks like it's just going to be a question on the progress reports. And the NIH has said that additional compliance monitoring processes may be implemented in the future. And again, this is kind of a big question mark right now. But again, I was just going to say, but in general, if you're sharing data with a repository, one of the things that a lot of repositories will do is they'll actually have a curator review your deposit prior to making it public. Not all repositories have this, but one thing that a curator will do is look at it and make sure that, can the files be opened, but also, is enough information being shared along with the data to help make sure people can actually understand and use it. So for example, if you have a data set that really needs a data dictionary, a curator will look at that and say, we really need the data dictionary in order to make this data useful. So it's not like they're going to be enforcing it, but it is something that any good repository with a curator will recommend. Make sure you're sharing enough information with your data so that it's actually usable.
So I appreciate the many contributions Peter Higgins has made to the presentation today. And I see the question about, will MISHAR or CTSU have a professional data manager on a charge per hour basis? Excuse me, I believe that MISHAR already does. I know they have a data management group, so I would check on the MISHAR webpage, but I will also bring that question forward loud and clear to both MISHAR and the CTSUs to see that as we all move forward, leadership is aware of budgetary and resource needs on the part of the university community.
Yeah, so MISHAR they offer data management mentoring. So I don't know if that's exactly, what you're looking for, but they do have that, and they do have an online course, it's like a basic data management or something like that, I think, which you can get to through their website as well. But I don't think they have a professional service yet.
Yeah, I think they can build a database for you though, if you want, and that build is, I think, on an hourly basis. I don't know if it's, maybe you may be right that maybe the question was asking more about sort of the afterwards, the further curation pieces. I'm not sure how well that exists.
Yeah. And I just want to confirm, okay, Melissa had asked, won't this time frame also affect the budget? For example, the costs of the data sharing have to be spent before the end of the grant period. I just want to confirm, yep. As Diane mentioned, any costs have to be incurred before the end of the grant period. One thing that NIH has said is that it's possible that no-cost extensions may be utilized to help researchers make sure that they're meeting their data sharing requirements prior to the end of the project. And I know that's going to be, I think that's going to be a challenge. And then Kristen had put in, so is this DMSP a document that needs to be updated if things change over the course of multi-year studies? So yes, the NIH expects that if something changes where your data management plan, for whatever reason, needs to be updated, they are expecting you to make sure that that stays updated. So researchers, that's part of that oversight and responsibility piece, that last piece. The PI most likely is going to be responsible for making sure to keep that updated. And again, that can be a conversation with the program officer whenever it's needed, to make sure that that document is staying updated as needed. I saw Peter put in NCTX in there. I actually don't know what that refers to. Diane, do you know? Or Peter, if you want to put in some explanation. Oh, no cost time extension. Thank you. Acronyms. Whew, there's so many. All right, I think we covered the questions that have come up. If someone did not get their question answered, please stick it back in the chat. We have a few more minutes left. I want to make sure we get that. But if we're not able to get to your question, please feel free to reach out and ask it either to myself or Diane, or a couple slides back, we had some email addresses for I'm on a data team here at the Taubman Health Sciences Library. So yes, and when and where will the webinar be posted? So we were told it will probably take several days to get the recording. They're going to edit it, add some captions. So it'll probably be at least several days, but by next week, it should be available on the Navigate website as well. Okay, I just saw another question. So when discussing retrospective data, there was a comment about whether the consent form covered it. How about non-research retrospective data that are collected as part of clinical care? So for example, it's secondary use of data. Diane, do you want to take a stab at that?
So I will take a little poke at it, but I guess I would say that with respect to that, you probably want to start by talking with the DOCTR office, along with people like Sarah, as far as your plans go. There are, the DOCTR office runs the committee for the consideration of the use of clinical data, and generally speaking, for research purposes, there's quite a bit of flexibility there, but we are going into further new territory here. So if it was collected clinically under clinical consents that did not refer to use in research contexts, then there may be some real constraints. And again, we want to honor NIH's desire to share more, but we can't re-engineer the past, and we don't want to create new versions of the Henrietta Lacks problem or other cases where people feel taken advantage of or hurt by things that we're doing. So if you believe there is a constraint, look hard and deep to understand the borders of that constraint well. Talk to DOCTR, talk to our office. Even though I don't have an answer, case by case right now, we'll help dig into it and figure it out. And it's okay to be a little on the cautious side and have, but just explain that's what your plan is, how it's limited and why. They're not asking us to jump to 2050 right now. They're asking us to move to 2050 and make progress in that direction. So there will be some research that can move a lot faster than others, and we want to honor that. And
Yeah,
sorry, go ahead.
I was just gonna say, NIH really just wants you to make sure, like, if there are limitations, that you can articulate and understand what those limitations are with the sharing.
Exactly. And thank you, Peter, for stating your concern about training. Yes, you can probably help that get to the right parties even better than we can, but we'll try to share that forward as well. We're happy to meet with you offline to brainstorm, like, who all else do we need to talk to, and where else can we present in meaningful ways that help the whole university prepare in due speed for the future.
Yes, and I just want to acknowledge that we are at noon. So thanks everyone again for coming to our webinar, and I'll stick the link to the slides in the chat one more time, just in case you didn't have a chance to grab that. And again, I encourage you to reach out with any questions that you have. And yeah, thanks again. Enjoy the rest of your day.